Hamilton, Ontario. September 21, 2017. Physical activity of any kind can prevent heart disease and death, says a large international study involving more than 130,000 people from 17 countries published this week in The Lancet. The prospective urban-rural epidemiology PURE study, led by the Population Health Research Institute of McMaster University and Hamilton Health Sciences, shows any activity is good for people to meet the current guideline of 30 minutes of activity a day, or 150 minutes a week, to raise the heart rate. Although previous research from high-income countries shows leisure time activity helps prevent heart disease and death, the PURE study also includes people from low- and middle-income countries, where people don't participate in leisure time physical activity. By including low- and middle-income countries in this study, we were able to determine the benefit of activities such as active commuting, having an active job, or even doing housework, said principal investigator Dr. Scott Lear. He added that 1 in 4 people worldwide do not meet the current activity guideline, and that number is nearly 3 of 4 in Canada. Lear holds the Pfizer Heart Stroke Foundation Chair in Cardiovascular Prevention Research at St. Paul's Hospital in Vancouver, and is a professor of Simon Fraser University's Faculty of Health Sciences. The PURE study showed that, by meeting the activity guidelines, the risk for death from any cause was reduced by 28%. While heart disease was reduced by 20%, and it didn't matter what type of physical activity the person did. The benefits also continued at very high levels with no indication of a ceiling effect. People getting more than 750 minutes of brisk walking per week had a 36% reduction in risk of death. However, less than 3% of participants achieved this level from leisure time activity, while 38% of participants achieved this level from activities such as commuting, being active at work, or doing household chores. Lear said that, in order to realize the full benefits of physical activity, it needs to be incorporated into daily life. Going to the gym is great, but we only have so much time we can spend there. If we can walk to work, or at lunchtime, that will help too. For low- and middle-income countries, where having heart disease can cause a severe financial burden, physical activity represents a low-cost approach that can be done throughout the world with potential large impact, said Dr. Salim Youssef, director of the Population Health Research Institute and the principal investigator of the overall PURE study. If everyone was active for at least 150 minutes per week, over 7 years a total of 8% of deaths could be prevented, he added. The PURE study was led by the Population Health Research Institute and conducted in over 70 sites in 17 countries. It is funded from more than 50 sources, including the Population Health Research Institute at McMaster University and Hamilton Health Sciences, the Heart and Stroke Foundation of Ontario, the Canadian Institutes of Health Research, and the Ontario Sports Support Unit. The Population Health Research Institute (FRI) is a joint research institute of McMaster University and Hamilton Health Sciences Corporation. It is Canada's premier global health research institute and a world leader in large clinical trials and population studies. Originally formed with a focus on cardiovascular disease (CVD) and diabetes, FRI's research areas have broadened to include population genomics, perioperative medicine and surgery, stroke, thrombosis, renal disease, and obesity, with unparalleled expertise in epidemiology, population health and clinical trials. For more information, please visit http://www.fri.ca. Providence Healthcare PHC is one of Canada's largest faith-based healthcare organizations, operating 16 healthcare facilities in Greater Vancouver. PHC operates one of 2 adult academic health science centers in the province. St. Paul's Hospital performs contingent research in more than 30 clinical specialties and focuses its services on 6 populations of emphasis: cardiopulmonary risks and illnesses, HIV/AIDS, mental health, renal risks and illness, specialized needs in aging, and urban health, and is home to the BC Centre for Excellence in HIV/AIDS. http://www.providencehealthcare.org. For interviews with Scott Lear, contact Elaine Young, Senior Communications Specialist, Media Relations, Providence Healthcare, T604.682.2344X 66987 M604.837.6003 Eaong at providencehealth.bc.ca.